Okay, let's jump right in. We're starting today with a deep dive into something that might feel a little uncomfortable, maybe even morbid. But trust us, it's incredibly vital. We're exploring the surprising, powerful lessons that can be learned from, well, from studying how people die. It turns out the unique perspective of a medical examiner, someone who literally sees death every single day, offers really unparalleled insights into how the living can actually avoid it prematurely. We're taking a deep dive into source material drawn from the extensive experiences and findings of a medical examiner, seeing thousands of cases up close. Our mission with this deep dive is singular, to extract the absolute key nuggets of knowledge from this unique vantage point to help you make choices for a longer, safer, healthier life. It's about learning from the end to better inform your living.
And that framing is spot on. The medical examiner's work, that incredibly detailed process of autopsy, taking meticulous notes, photographs, the internal examination organ by organ, slicing them to look for irregularities, sending samples from microscopic slides and toxicology tests. It's not just mechanics, it's a relentless search for answers. And what thousands upon thousands of these examinations reveal is a profound, sobering truth. So many deaths are, well, entirely preventable. The lessons for the living are found, often starkly, in the intricate details of how people ended up on that autopsy table.
Right. And I imagine seeing those details every day gives you a completely different perspective than someone just reading a health article. Like, the source shares this really vivid example. An elderly man with dementia found face down. Initially, it looked suspicious, but the investigation showed he was confused, cut his hand, slipped on ice, and fell. Simple accident, maybe.
Yes, on the
Right.
surface.
But the fascinating part was how the medical examiner used this seemingly routine case to show her producer something even more fundamental. She pointed out how the man's colon, inside his body, revealed severe damage diverticulitis caused by years of a Western diet lacking fiber and exercise.
Hmm.
The source says seeing that visual proof, how the lack of fiber caused slow movement and increased pressure, made prior health advice click for the producer in a way it never had before. That's powerful.
It really is. It transforms abstract advice about diet or exercise into concrete, visible consequences inside the body. This perspective provides a new, kind of undeniable understanding of your health and the very real internal price tag of your everyday decisions over time.
Which leads perfectly into one of the most basic, yet consistently ignored, aspects of health seen from this angle.
Mhm.
Listening to your own body and critically seeking medical care when something's wrong.
Absolutely. The morgue sees the tragic final act of problems that started small. Take the case of Victor. He died from a tooth abscess.
A tooth abscess,
Yeah.
really?
Yeah. Now, a tooth infection might seem minor to some, but in his case, the bacteria spread from the decayed tooth into the surrounding bone and tissue, creating a deep abscess in his neck. By the time he finally sought help, the infection had spread into the vital tissue planes and down into his chest. Once bacteria hit the bloodstream, you're looking at multisystem organ failure,
Wow. Just from a tooth.
just from a tooth issue that wasn't addressed. We also see the devastating end stages of chronic diseases. Kimitani's death, for example, revealed severe, widespread damage, kidneys, liver, and coronary arteries over 95% blocked. All of this stemmed from long-standing untreated diabetes.
And diabetes, just to quickly clarify for our listener, is essentially a problem with how your body handles glucose or blood sugar.
That's right. When glucose can't get into your cells properly and builds up in your bloodstream, it's highly toxic over time. It silently damages blood vessels and organs throughout the body. Kim's case also showed blindness, severe periodontal disease, that serious gum infection, and gangrene, all grim complications of her diabetes being unmanaged for so long.
It's awful.
And here's a pattern observed specifically from this perspective that's quite striking. Men, on average, are significantly less likely to see a doctor than women. They tend to ignore or repress pain, dismiss symptoms, and delay seeking help. This reluctance is actually cited as a probable contributor to the fact that men have a shorter life expectancy than women by around 8 years.
Wow, 8 years. That's a huge potential cost for delaying care. So what's the actionable takeaway here for you, the listener?
It comes back to being proactive. First, find a doctor you trust. You're going to be sharing incredibly intimate details about your body and life. If you don't feel comfortable or heard, that's a signal to look elsewhere. The source even provides a helpful list of 10 questions to consider when choosing a new doctor, like checking your board certification, how they handle referrals and lab tests, if they're in a group practice with backup, and which hospitals they're affiliated with. The practical stuff.
That's practical. And the source makes another critical point about talking to your doctor, right?
Yeah.
It's not just finding one, but how you communicate.
Exactly. You are your own best advocate. You know your body better than anyone else, even your doctor. There's the case of a woman who died of meningitis. She went to her doctor, but she only reported lower abdominal pain.
Oh, no.
Yeah. She never mentioned the fever, headache, or stiff neck, the typical meningitis symptoms. Her doctor treated the symptoms she presented. Your doctor relies on all the clues you provide. You need to share every symptom, every change you've noticed, even if it seems unrelated. And be specific about pain. Where is it? What does it feel like? Is it dull, sharp, throbbing? Does it move? Honest, detailed communication with your healthcare professional is absolutely vital.
Okay. Moving from doctor's offices to medicine cabinets, let's talk about something we generally think of as safe: medications and supplements. But the morgue reveals a surprising, often deadly side when these are misused or combined incorrectly.
This is a huge area seen daily. The core insight here is that no medicine, prescription, or over-the-counter is 100% safe for everyone all the time. They all come with potential risks and benefits. Doctors call problems arising from taking a drug an adverse effect, and these can range from mild side effects to severe reactions, interactions, or even toxicity.
Right.
A major risk factor, particularly for the elderly, is polypharmacy.
And that just means taking multiple drugs at once.
Precisely. The more medications you're taking, prescription and OTC, the exponentially higher the risk of a dangerous drug-related interaction. The source gives examples you might not even think of. Antacids can reduce the absorption of crucial blood-thinning drugs, or taking aspirin with blood thinners can drastically increase your risk of dangerous bleeding.
Simple things you wouldn't suspect.
Exactly, but here's where it gets really interesting. One of the most frequent and deadly combinations seen repeatedly in the morgue is alcohol mixed with central nervous system depressant drugs.
Okay, like what kind of drugs?
These are things like tranquilizers, barbiturates, even common anxiety medications like Valium or pain relievers like Darvon. The source states deaths from this specific combination are seen almost every single day.
Every day. That's shocking.
It is. And we can't forget herbs and supplements. So many people use them, nearly 1 in 5 report using herbs, but over half don't tell their doctors.
Why not?
Maybe they think it's natural, so it's fine. But this lack of disclosure is incredibly risky because these natural substances can and do interact dangerously with prescription drugs.
That's a really critical point. So the practical advice, based on this perspective, seems pretty clear. Full disclosure is non-negotiable.
Absolutely. Keep a single, up-to-date list of everything you take. Every prescription, every over-the-counter pill, every vitamin, supplement, and herb. Show that list to your doctor at every appointment. Also, make sure they know about all your drug allergies, any other doctors you're seeing for different conditions, if you smoke or use alcohol, or if you're pregnant or breastfeeding. This is essential information for your doctor to catch potential conflicts.
Good advice.
And you can empower yourself, too. The source suggests reputable online resources like medscape.com or drugs.com have interaction checkers. You can plug in your medications there to flag potential issues. Also, a key piece of advice: resist the urge to ask for antibiotics or take them unless they are truly needed, prescribed by your doctor for a confirmed bacterial infection.
And dosage instructions can be surprisingly tricky sometimes, can't they?
They can be. 4 times daily might mean every 6 hours around the clock, or just during waking hours. It's not always clear. Always read your medication labels carefully, and if you're unsure, ask your pharmacist or doctor for clarification. Taking more than recommended can make you seriously ill or worse.
Makes sense.
Circling back to dietary supplements for a moment, it bears repeating. Many assume they are safe because they're natural or available without a prescription, but they can have significant harmful effects, particularly in high doses or combined with other drugs. They are absolutely not a replacement for a healthy diet. The source shares the tragic case of Lisa Aarons, who seemed healthy but died suddenly and unexpectedly. The autopsy ultimately linked her death to excessive supplement use, specifically high doses of DHEA, which appeared to trigger a fatal heart arrhythmia.
Wow. Just from supplements.
Yeah.
Okay, let's shift gears now to accidents. While some are unavoidable tragedies, this is another major killer, especially for younger people, where the morgue consistently reveals how preventable actions lead to death.
It's a stark reality. Accidents are the 5th leading cause of death overall in the U.S., but for people between the ages of 1 and 44, they are the #1 killer.
Number 1. That's significant.
Okay, let's unpack this. The findings from thousands of traffic fatalities are unequivocal. Seatbelts save lives. Why? Primarily because they keep you inside the vehicle.
Right, being ejected is often fatal.
Dramatically reduces your survival chances. They literally double your odds of survival in a crash. And crucially, you have to wear them correctly, both the lap and shoulder harness, with the seat back properly upright. The chilling detail from the source is seeing bodies nearly cut in half because only the lap belt was used.
Horrifying.
Driver inattentiveness is a huge factor, causing around a quarter of crashes. The source tells a story of a young girl who died after just glancing away for a moment to change her CD.
Just a moment.
Yeah. Other common attention stealers include rubbernecking at accidents, being distracted by passengers, especially kids in the back, and of course, cell phones. And it's not just talking. The content of the call, like an emotional argument, can be more distracting than the act of talking itself.
That's interesting. I appreciate the medical examiner even sharing a personal anecdote about having her own accident pulling out of the garage and yelling at her son. It just drives home how easy it is for anyone to have a moment of inattention that leads to trouble.
It really does. Another point they make is the danger of driving with windows partially down. In a crash, you can be partially ejected, leading to horrific injuries. And any unrestrained item in your car, groceries, a laptop bag, jumper cables, becomes a potentially lethal missile in a sudden stop or crash. Secure everything.
Good point. Hadn't thought of that.
Drunk driving is another clear link seen repeatedly in the morgue. The risk of a crash escalates dramatically with increasing blood alcohol concentration, or BAC. The tragic case of 19-year-old Jimmy Fredericks is shared. He died in a crash, speeding on suburban streets with a BAC over twice the legal limit.
Oh, no.
Moments after celebrating beating a DUI charge he'd received just weeks earlier.
Just terrible irony.
It is. Drowsy driving is also a significant cause of accidents. The case of Jeremy Decker, a 21-year-old student who died after falling asleep driving through the night, is a potent reminder of this danger.
Easily done if you're tired.
Very easily. And the source offers simple tips for traffic sense. Learn from observing crash patterns. Traveling in the center or right lane when possible, maintaining plenty of space around your vehicle, letting aggressive or poor drivers pass you rather than engaging, and always using your turn signals. Simple things, but they reduce risk.
Okay, moving indoors, what about home accidents?
They account for over 15,000 fatal injuries per year, with falls being the #1 killer at home, especially for older adults.
Falls, okay.
Carbon monoxide, or CO, is another silent danger in the home, often resulting from faulty heating systems or using generators or charcoal grills indoors. It's odorless and colorless, but installing CO alarms on every floor is a cheap, effective lifesaver.
Definitely need those.
Child safety is another area sadly seen in accidental death cases. Suffocation is common in infants, often due to unsafe sleep environments or cords. Tying up window blind cords is crucial.
Right, those cords are dangerous.
Choking hazards are also frequent. Anything that fits in a small airway is dangerous, like small objects or balloons. The source mentions a case of a 7-month-old who choked on a piece of a popped balloon given to him by his older brother.
Oh, that's heartbreaking.
It is. Dog bites also send hundreds of thousands to the doctor every year, half of those being children, particularly ages 5 to 9. The source recounts a horrific case of a 4-year-old killed by tethered pit bulls after chasing his ball into a neighbor's yard.
Oh, God.
Prevention involves choosing a suitable breed, proper training, socialization, teaching children safe behavior around dogs, and never tethering a dog, as it can make them aggressive.
Good tips. What about guns?
Gun safety is also highlighted, with around 200 accidental child deaths per year in the U.S. Proper storage, using trigger locks, and teaching kids that guns are not toys are vital.
Okay. What's fascinating here, and you mentioned it earlier, is the pattern seen in men dying from accidents.
Yes, it's a recurring theme. They die from accidents at rates more than twice as high as women overall, and as we noted, it's the #1 cause of death for men ages 1 to 44.
And the types of accidents are different, too.
They often are. Car crashes frequently linked to aggressive or drunk driving, drowning, often involving stunts or overestimating ability, and firearms, typically due to mishandling. The medical examiner shares the observation, agreed upon by her male colleagues, that, well, men do stupid things related to risk-taking.
A bit blunt, but maybe there's something to it.
It's potentially linked to macho conditioning and social norms that encourage boys to take risks more than girls, who are often socialized to be more cautious. The source even includes the statistic that men are 9 out of 10 murder perpetrators and 8 out of 10 murder victims, highlighting a broader pattern of male involvement in violence and risk.
That's a stark statistic.
The guidelines for avoiding accidents, drawn from these observations, include fundamental things. Trusting your internal gauge of danger. If it feels risky, it probably is. Avoid destructive substances that impair judgment. Get annual checkups, framing it like a car needing regular maintenance, reminding men they need tuning too, and being a responsible sexual partner to avoid deadly infections.
The mention of destructive substances leads directly into another major factor seen constantly in the morgue that results in preventable death.
Substance abuse.
Alcohol abuse is a huge part of this. The source defines what they consider hazardous drinking levels. For men, it's more than 4 drinks on one occasion or 14 in a week. For women and the elderly, it's more than 3 drinks per occasion or 7 in a week.
Okay.
While there is debate about moderate drinking having some protective effect, the severe risks of abuse are undeniable from this perspective, leading to accidents, suicides, and homicides. The source emphasizes that if you have a problem, seeking counseling and building a supportive network of non-drinking friends is absolutely vital. And it's not just alcohol on its own, but how it interacts with other health conditions or substances, right?
Exactly. The case of Tony Solito, a 29-year-old diabetic man who died after heavy drinking, illustrates how alcohol poses a particular risk for those with underlying medical issues. Then there's the truly disturbing story of James Conner, whose cocaine addiction was so severe he lived with his deceased father's body for days just to keep collecting retirement checks needed to buy more drugs.
That's unbelievable. Grim.
It paints a grim picture of the lengths addiction can drive someone. Cocaine specifically is seen across all demographics and income levels, whether it's powder or crack. Crack creates an incredibly intense, almost relentless craving. The source details the deadly dangers of cocaine use seen in the morgue. Severe cardiovascular problems like sudden cardiac death, heart attack, and aortic rupture.
A tear in the main artery.
Yes. Also neurological issues like stroke, pulmonary problems, severe psychiatric effects, and infectious complications. The case of the 62-year-old Miami cabaret performer who died from a dissected aorta is a classic example. He had high blood pressure, and the cocaine spiked it, causing the main artery to tear. And the source shares the chilling case of 2 brothers who used the same amount of cocaine, but one died and the other didn't.
That's terrifying. It's not dose-dependent at all.
No. The source explicitly states that using cocaine is like playing Russian roulette. You simply never know how much or how little will kill you on any given occasion.
Chilling.
Prescription drug abuse is also a crisis medical examiners are witnessing daily. Taking more than prescribed, even if it's for pain, can rapidly lead to dependence and addiction. The tragic case of Anne, addicted to pain medication, who died from an accidental overdose of multiple drugs she was taking, underscores this. The patterns seen in the morgue, like clusters of prescription drug deaths, highlight these public health issues and can actually inform prevention efforts to restrict access and educate the public.
I really appreciate the medical examiner sharing the blunt message she gives her own kids. Drugs are a road to nowhere. It's a clear, direct warning. And the source notes help is available for addiction.
Yes, absolutely. Options include various rehab programs, residential or outpatient, and medications like methadone or naltrexone, which can help people reduce their drug use while getting treatment. Reaching out is the crucial first step.
Okay, let's talk smoking.
Right. Switching gears to smoking, the source calls it the single most preventable cause of premature death, period.
The single most preventable.
Yes. Why? Because tobacco smoke is packed with thousands of toxic compounds, and nicotine is one of the most highly addictive substances known. At autopsy, the visual difference between a smoker's lungs and a healthy person's is striking. Smokers' lungs appear gray, even black, ribboned with pigment compared to healthy, pinkish lungs. You also see signs of emphysema, a lung disease often caused by smoking, where air gets trapped. These lungs often deflate like a popped balloon when cut.
What a visual.
Nicotine is fascinating from a chemical standpoint. It's a stimulant and a relaxant simultaneously, hitting the brain incredibly quickly after inhalation and acting on the reward center, making it intensely addictive. And the source notes that cigars carry similar dangers to cigarettes.
Good to know.
There's a case shared of a woman who died from end-stage lung disease and burns. She had been smoking while using oxygen at home, a deadly combination.
Oh, my goodness.
And we see the tragic impact of secondhand smoke, especially on children, increasing their risk of asthma, infections, and sadly, it's linked to sudden infant death syndrome, or SIDs, which is unfortunately seen too often in the morgue.
But the hopeful message here is that smokers can quit. It makes a massive difference.
It absolutely does. The source emphasizes that there are many strategies that work. Seeing a doctor for therapies like patches or medication, getting social support, learning new skills to cope with cravings and triggers, disrupting the routine patterns associated with smoking, and persistence, it often takes multiple attempts.
So don't give up.
Exactly. And the health benefits of quitting are dramatic and begin happening almost immediately, even later in life. Quitting significantly reduces your risk of heart disease, stroke, and lung disease over time. It's perhaps the single most impactful health decision someone can make if they smoke.
Let's turn now to risks in places you might assume would be safe, like hospitals or even on vacation when you're trying to relax and get away from it all.
This is a surprising area seen by the medical examiner. Hospitals, while places of healing, also carry risks. The source points out issues like having multiple doctors involved in your care without a clear, single picture. Sometimes not even knowing the names of the doctors treating you, or your primary doctor not closely following your progress during a hospital stay. The key takeaway here is that you must be an active patient and do your due diligence, especially before any scheduled procedures.
Be involved in your own care.
Absolutely. The case of Isabel is a somber example. She died from a misdiagnosed ectopic pregnancy. That's when a fertilized egg implants outside the uterus, usually in the fallopian tube, and is a medical emergency. Her death underscores how hospital errors can have fatal consequences and how autopsies can provide critical quality control by exposing mistakes and evaluating the diagnostic and treatment procedures that were followed.
Autopsies as quality control. Interesting.
Very much so. Hospital-acquired infections are another major concern seen in the morgue. The source is blunt. Hand washing is the single best protection against dangerous bacteria like MRSA and C. difficile. The medical examiner shares a powerful personal anecdote about refusing care for her son in the ER until a nurse washed her hands after touching another patient.
Good for her.
Right. Gel sanitizers are also effective when soap and water aren't available.
Okay.
Surgery and anesthesia carry their own risks, including allergic reactions. It helps to know your family history here, and the crucial need to disclose all medications you take and any heavy alcohol use, as withdrawal symptoms post-surgery can be life-threatening.
That disclosure point again.
It keeps coming up. Deep vein thrombosis, or DVT, is another significant, often silent risk. This is when blood clots form, usually in the legs, due to sluggish circulation from immobility. Often after surgery or during long periods of sitting, like on a long flight. If a piece of that clot breaks off and travels to the lungs, it's called a pulmonary embolism, or PE, and it can cause sudden death.
Which is exactly what tragically happened to Julian Noble. His sudden death was caused by a pulmonary embolism from a blood clot that formed in his legs after a long flight. That makes the risk feel very real.
It does. Transitioning to vacation risks, it's ironic you go to relax but face new dangers. Amusement parks statistically are incredibly safe. The injury death rate is less than 1 in 50 million rides.
That's very safe.
Very. But when deaths do occur, they're almost always due to pre-existing health conditions, like a heart condition exacerbated by the physical stress of the rides, like Martin Landers, who had a heart attack on a water slide. G-forces are mentioned, but they're rarely the direct cause of death, though they certainly put stress on the body.
Okay. What about water risks?
Water risks go far beyond drowning, which is dangerous enough. The source discusses the terrifying reality of killer amoebas, specifically Naegleria fowleri.
Killer amoebas. Seriously.
Yes, found in warm freshwater lakes, rivers, ponds, hot springs, and even poorly chlorinated pools. The infection happens when the amoeba enters through the nose, typically when diving or jumping into water. Symptoms start with severe headache, fever, vomiting, and stiff neck, rapidly progressing to confusion and seizures. Survival is incredibly rare because the amoeba literally attacks and feeds on the brain.
That sounds horrific. What are the main takeaways for water safety based on this?
Core safety tips include avoiding alcohol or drugs while swimming or boating, always swimming in supervised areas, being aware of and avoiding rip currents in the ocean. Never diving into shallow water, wearing life jackets when boating, and getting proper training if you plan to scuba dive. Basic stuff, but crucial.
Got it. And travel abroad.
Finally, for international travel, travel medicine is crucial. Check with your doctor about existing health issues and your immunization status well before your trip. Certain vaccines are required or recommended depending on your destination for illnesses like yellow fever, meningococcal meningitis, typhoid, hepatitis A and B, Japanese encephalitis, and rabies. The CDC, the Centers for Disease Control and Prevention, is a fantastic resource for checking health information and vaccine recommendations for different countries.
Okay. This has covered a lot of ground, much of it quite sobering. Let's bring it back to the broader picture, living fully, and how these lessons from the end can inform longevity and well-being.
Right. The cautionary case of Mary Nance, the woman in the chair, found dead in squalor, really underscores the medical examiner's observation about the importance of finding purpose and maintaining order in your life. Without these, both physical and mental decline can accelerate rapidly.
Purpose and order.
Yes. The source highlights the strong, undeniable connection between the mind and body, something research supports and is arguably seen in these cases. Stress can weaken the immune system while positive emotions seem to strengthen it. Findings show optimists tend to live longer, healthier lives. This isn't just about mood, it's linked to their behaviors. They're more likely to utilize healthcare, maintain healthy diets, and exercise, and they experience lower rates of depression.
So cultivating a positive, rational attitude actually translates into concrete health benefits.
It appears so. Accepting life's inevitable challenges, actively trying to find something good even in difficulties, and approaching things with phrases like, "it's worth a try," or "I accept the challenge," seems beneficial for both mental and physical resilience. The medical examiner shares a personal story about overcoming severe seasickness just to enjoy a fishing trip with her family, illustrating the benefits of pushing past discomfort and fear for new adventures. New experiences, she notes, build knowledge, experience, confidence, and ultimately, happiness.
Love that. Push your comfort zone.
Exactly. Sleep is also absolutely critical and often overlooked until it contributes to problems seen in the morgue. Chronic sleep deprivation is linked to an increased risk of accidents, drowsy driving, for example, but also heart disease, cancer, diabetes, memory problems, and depression. The case of Marcus Bennett, who died by suicide, is mentioned alongside his documented history of significant sleep problems.
Sleep is fundamental.
Getting good sleep needs to be a priority for health. Simple tips include keeping consistent bedtimes and wake times, avoiding caffeine, nicotine, and alcohol before bed, having a relaxing wind-down ritual, and getting up if you can't sleep, rather than just lying there tossing and turning.
I was struck by the medical examiner also sharing her personal story of remarrying her first love after many years, seeing it as life coming full circle. It adds a layer of warmth and shows that amidst the difficult work, there's a recognition of life's joys and the importance of connection.
It does. It brings balance. And finally, the case of William, who died of a pain medication overdose, but the autopsy also revealed underlying severe heart and lung disease linked to obesity and smoking. The source speculates that perhaps a long history of unhappiness could have contributed to those poor lifestyle choices and, ultimately, his health outcomes.
That mind-body connection again.
It suggests a complex interplay between our emotional state, our behaviors, and our physical health trajectory. The fundamental lessons the medical examiner reiterates at the end, drawn from thousands of cases, are almost deceptively simple. Use medications exactly as prescribed, practice good hygiene, like regular hand washing and using condoms, drive carefully and always use your seatbelt correctly, and unequivocally say no to tobacco, excess alcohol, illicit drugs, and the abuse of prescription medications.
So what does this all mean? We've taken a journey through the unique, often confronting perspective of medical examiner, seeing vividly how, again and again, preventable actions and untreated issues lead to premature death.
The tragic cases witnessed in the morgue powerfully underscore the importance of seemingly simple choices we make every day. Choices related to what we eat, how we move, whether we seek timely medical care, how we handle medications, whether we engage in risky behavior, how we manage addiction, and even how we cultivate our mental and emotional well-being.
Simple choices. Huge impact.
Exactly. Learning these difficult, vital lessons from those who can no longer live provides a potent, practical blueprint for you to make informed choices today to live a longer, safer, and healthier life.
Here's a thought to take away from this deep dive. Considering the vivid, often preventable endings seen on the autopsy table, the results of choices that were made or avoided, what simple, actionable choice can you make today to change the trajectory of your own story? What will you do differently now, knowing what the dead can teach the living?